the topic is pretty basic actually. And it won't take long. This lecture this afternoon won't take long. And if there is time, can we cover the last topic as well? Hello.
Can, no problem.
So if there is still time, then we'll cover the last topic as well. Tapi nanti ada masalah pada attendance pula nanti. Okay. So nanti kena ada 3 case slot kan. Never mind lah, we'll just do it on Wednesday. Okay, I'm going to stop sharing this. I believe you all have downloaded all the notes from UKM Folio, right? Betul, betul.
Yes, sir.
Okay, gonna stop sharing this. Okay, down. Okay, can you see that?
Yes, sir.
Okay, it's supposed to be at the beginning of the course. No? All my actions supposed to be at the beginning of the course, but somehow been brought all the way to the end of the semester. Have you had your semester break already?
Yes. Yes.
Huh?
Yes, okay. Yes.
Oh, dah. When's your exam?
Man.
Huh? When is your exam date? Your study week?
1st of February.
Also February. Okay, say long time. So there's still plenty of time. Eh? Okay, so basically, at the end of this lecture, you should be able to understand the 4 pillars of the medical ethics. I think you all know about the medical ethics, right? Ethical issues what are the ethical issues in occupational health, and then in relation to concept of medical information confidentiality, everything is known to you as a medical practitioner. And then last one is role of International Code of Ethics for occupational health. Okay. And so basically, what are the 4 pillars of medical ethics? Anybody? Google dulu kan apa? Tak ingat lah medical ethics. Belajar apa dulu? Tak ada yang tahu ke? Sedih saya. You all punya medical ethics apa? Ramai doktor kan? Ke tak ada doktor dalam grup ni?
Do no harm, doctor. Do no harm.
Yeah, non-maleficence. Yeah, exactly. 1.
Justice.
Justice, yes.
Autonomy.
Yeah, patient autonomy. And last one is what?
Beneficence.
Beneficent, yeah, do good. Okay. So basically, if you sort of like hold on to that kind of principle, beneficent, non-maleficence, justice, and patient autonomy, you'll be fine as a medical practitioner in any aspect, either in public health or clinical, or in the clinical setting. Okay. So in terms of medical versus occupational health, okay, this is basically an introduction to the differences between a normal GP in comparison to occupational health doctors. Okay, So if you decided to become an occupational health doctor, technically you have to register with DOSH and then be registered as OHD on top of your medical license under the MMC. Again, you have got your full registration right under MMC to practice as a medical doctor, right? But to work as an occupational health doctor, you need to get another license from DOSH in order to practice OHD. Okay. So basically, that's the difference between normal doctors and OHD doctors lah. And basically, normally in clinics or in outside clinic and private clinic, they normally have they provide these both services, which is in terms of medical services and also occupational health services. Okay, because it's a matter of getting client. Where if you have OHD, you can market your clinics to industries, right? So they'll be able to send their employees to you. So you have a better group of patients, a larger group of patients. And then both can be in the form of panel doctor and both can be in the form of implant doctor, meaning say for example, if implanting meaning sort of like in-house doctors, okay, and then I've told you about OHD, and then medical, and sometimes if say for example if you decided, say for example some of you interest in occupational, and then decided okay I don't want to work with the government anymore. And then basically you can become a medical and occupational health advisor in the industry as well, especially in oil and gas industry, petrochemical industry, and so on and so forth. And you can also become a corporate occupational physician. So most of your clients will be in the form of employees or union employers. And you have a close license with safety and health unit, human resource departments, and also finance department, in order for you to be able to do your job well as an OHD. Okay, if you are working in-house or as an occupational health advisor. Okay? So these are the medical ethics, as somebody mentioned, beneficence to do good. Non-maleficence is duty not to do harm, respect for autonomy, and justice. I suppose you all know what is it all about, right? Betul tak? Betul tak betul? You all know, right?
Yes, doctor.
Senden ke atas kali ni nama Ahmad Farid.
Yes, doctor. Here, I'm here.
Ahmad Farid. Beneficent, what does it mean? Can you elaborate?
Pass.
You bukan medical doctor ke?
Medical doctor.
Ya. Hilang pula dah saya punya benda ni. Okey lagi ke? Okay. Lagi. Okay. And beneficence. Meaning you do good lah. Meaning when you are dealing with patient, you don't want to cause them any harm, right? If you don't know anything, how to treat or how to properly treat the patient, that's where you refer the patient to another doctor who actually specializing in that area. So you don't do any harm. So there's no guessing game in medicine. Okay. Non-maleficent, duty of to do no harm. That means you apa dia? Non-maleficent macam mana pula?
Don't jeopardize the patient.
Don't jeopardize the patients. Elaborate. Give an example.
Same thing macam Dr. bagi tahu tadi kot. If let's say we receive a patient and it's not under our specialty, then we refer to the specialty involved accordingly.
Okay. Anybody else want to try? Tak ada lagi. Tak ada idea. Semua petani tak ada idea. Okay lah. Let's move on from the medical ethics lah. Okay. Okay. Move on to issues in occupational health. What are the issues in relation to ethical issues in relation to occupational health? The first one is unequal distribution of power, competing interests, lack of autonomy between the employees, employer, and the government. You know that under OSHA, it's involved a tripartite act in order for us to implement the OSHA. So it involves the employee, employer, and also the government or administrative and health practitioner. So in OHD, the unequal distribution of power, it simply means that in a place of work, the employer are the one who holds the power, right? And then the employee are the one who is working under the employer. And as a result, they don't have much say in terms of their working situations, right? Same thing macam if, say for example, you as an employer, you have maid in your house, right? Maid you pun tak berani nak cakap apa kan dengan you kan, because you hold the power, you are the one who's paying the salaries. So that's what it means by unequal distribution of power. And then in terms of competing interests, that simply means that as an occupational safety and health professionals or OHD doctors, and then you have competing interests. Either your interest is for the employees, or your interest is towards the employer, because the employer would demand certain things from you, whereas the employee also wants certain things from you. Okay? We'll later on. So with that regards, sometimes the employee doesn't want the employer to know what kind of disease they have. So in that sense, you end up with a conflicting interest in terms of either you listen to the employees or listen to the employer, because at the employer side, especially from human resource department, most of the time, if any of the employees was on prolonged sick leave, they need to know what was the reasons of the prolonged sick leave, so that they'll be able to do appropriate measures later on. And then in terms of lack of autonomy, that's more towards the employees versus the employer. So they don't really have they don't really hold any autonomy in certain workplaces. Okay. As a medical practitioner, you also experience lack of autonomy as well, because say for example, you are managing a patient, and then there's a senior doctors, or your specialist came in, you cannot really say anything about how to managing the patients, right? Betul?
Betul.
Kan? So basically you just have to follow the order, kan? So it simply shows lack of autonomy there. Then conflicting responsibilities, as I mentioned, loyalty to whom? Either to the patient, client, or the party managers. Okay. In terms of respect for person, in terms of autonomy and protection of person with diminished autonomies, which is the worker. That's sort of like we know that under the 4 pillars of medical ethics, you need to withhold patient. You have to hold on to patient autonomies, right? So that's when these conflicting elements came in. Either you need to respect for that particular person autonomies, or you want to protect the employees with a diminished autonomies. Diminished autonomy meaning they don't really have much to say, right, as a workers in the organizations, right? And then basically they solely base their judgment. Their most of the time the employee will say that the doctors know best. Again, especially in the lower level of grade of employees. Okay, and then in terms of distributive justice, basis of distribution of benefits among various group of workers. So sometimes there's a conflicting element there as well. Of course, the bosses will have a much better medical benefits, right? In contrast to lower level employees into the healthcare system as well, especially if you're working in the private sector. So everybody, the coverage is not. It's not the same, right, within the bosses and the regular employees. Dekat government pun sama juga. It's basically based on you punya grade kan. Dari JUSA ke, DU 54 ke, ada DU 51, so on and so forth kan. And either your the entitlement is completely different, right, between one person to another. Competency and accreditation in terms of occupational safety and health professional, laboratories, training and education program. In relation to occupational health, it is very important that you know that you know we have DOSH, right? DOSH is the body that sort of like accredit or provide the license and to ensure competency of all occupational health safety practitioners. That will include OHDs, that will include industrial hygienists, that will include chemical health risk assessors. So there is tons of professionals under OHD, and in terms of their competency and their accreditation is all been monitored by DOSH. And same thing in terms of laboratory as well. You will notice that there is certain say for example, I give you an example. For example, noise. They need to use automatic booth, and then this automatic booth need to be assessed by DOSH and give a certificate to be able to use automatic booth as a place to do medical surveillance among the workers. It's not the same as in the ENT department. We have the ENT departments, right? Kan, hospital kan the ENT department, they also do audiometric, right? So when you are dealing in this regard, you're not dealing with a patient. You don't need DOSH punya certificate or in order for you to be able to use audiometric booth, okay, or audiometric equipment. And then for you, certain PPEs, PPEs, there are PPEs that is recognized by DOSH, and only this kind of PPEs can be used by the workers lah. Okay. Scientific knowledge, access to information, right to know, manufacturer, supply, employee, scientific community, and the government. So, in terms of scientific knowledge, in terms of medical ethics, it is also was quite a problem there between the professional in OHD and also between the employer and the employee. Because a certain employer, they don't want the employees to know all the kind of hazards. They want if possible, not to tell the employees about the hazard that the employees are faced with when during their work. Okay, but because and if the employees knows about the hazard, there's a possibility that they might not have employees to work in that sector. Okay, so that's, but as an occupational health practitioner, it is your duty to explain to the employees about the hazard that they might be facing in the workplace as well. So that's where the conflict comes in. Okay, and then cost benefit analysis of certain program and so on and so forth. Okay. Application of screening practices in terms of fitness for work, medical surveillance, drug and alcohol testing, HIV testing, all these issues have ethical consideration into it, right? Because it's quite difficult, say for example, in terms of fitness to work, whether that person is fit to work or not fit to work. Because from the employer side, they want their employees to be able to work, right? So they want them to be fit. But as a medical practitioner, this is where your conflict come in, because you know that some of these the workers that you are treating, they are not fit to work, right? And then in certain work conditions, if possible, they don't want to have any lost time injury, say for example, LTI, because in certain work area, their bonuses are tied in with their LTI rate, lost time injury rate. Okay, so if say for example there's an employee who end up being injured in the workplace and unable to come to work, and then that means they have broken the LTI, and then as a result, the bonuses of everybody in that organization is being affected. Okay, so that poses a ethical dilemma as well to the medical practitioner. In terms of medical surveillance, it's the same thing. Drug and alcohol testing and also HIV testing and all those, I think either you need to do it or you're supposed to be doing it or not supposed to be doing it, right? Setting of permissible level of exposure. You know, in operational setting, we have you know about hazard already, right? And then you know about permissible exposure limits, right? The certain hazard, they have a specific permissible exposure limit. Say for example, noise. It cannot be more than 85 decibel over 8 hours period, thermometer average. Okay. So in setting up this permissible exposure limit, so it basically involves either from the corporate influence or political influence or society influence. Previously, our PEF for noise is 90 decibel thermometer average. Okay, and recent studies have shown that at 85 decibel thermometer average, 8 hours thermometer average, the employee can end up with noise-induced hearing loss. So it takes quite a while before the PEL of noise from it's been reduced from 95 decibel to 85 decibel. Okay. So it involves lots of all these elements, political influence, corporate influence, because in order for an establishment to be able to control this kind of all this what you get to have adequate control measures, it's quite costly to the organization itself. Okay, so can't just simply implement. Okay. So in terms of conflicting interests, in terms of protection of environment, protection of general public, protection of employees, protection of unborn fetus, so all this need to be taken into consideration because you know that job provide money, right? And they provide money. Lots of people are depends their livelihood for that particular job. Right? So the conflicting episode can be seen at the towards ensuring there is a job or in regards to protecting the environment or ensuring there's a job or protecting the general public. Because say for example, if you have a lot of factories and they produce a lot of environmental toxic, right? So you need to decide between the job or the public, and then what would be the best method to protect the employees. And in terms of protection of unborn fetus, meaning there are certain jobs, there's certain exposure to hazard can affect fetus or unborn fetus, right? Or, so say for example, lead, an example, right? So in a lead factory, should you or should you not employ a woman who is in the childbearing age to work there, or you should just employ male workers? So if you, I mean, it's very thin line to make that kind of decisions, right? If you just simply say that, okay, we're not going to hire female workers, so that can create problem where there's inequalities in terms of job application to the based on gender. So it will create problems and issues. Okay. In terms of confidentiality of information, as mentioned earlier on, the confidentiality of the information, how much information you need to be able to again give to human resource managers, to corporate medical advisors, how much information does the medical professional can give to all these other people other than information regarding the patient that they are managing or they are treating, right? In terms of to government agencies and also to the authorities. Okay. So when we talk about medical ethics, there's the element which is ethical distress and ethical dilemma. So ethical distress is basically the OSH practitioner knows which course of action should be taken for the benefit of the worker, but face a barrier in carrying out that particular actions. Whereas in ethical dilemma, basically there are two or more courses of action, each of which is right, but in choosing one of them, something of value will be compromised. So they end up having a dilemma that they should do this or should do that. Okay. Boleh lagi ke ni? Semua hidup lagi ke dah mati dah?
Ada.
Mati semuanya pengsan dah. Nah, I know that petang ni bila dengar pasal etik semua macam mata-mata pun apa? Keluar tengah kiri kan. Tak apalah, apa bertambah lah. In terms of confidentiality of medical information, these are the elements of, you know, medical information. Right? As a medical practitioner, we are being told that all the patient information, medical information are confidential. Right? So they need to have a written policy for management of medical records in the workplace, including a database in terms of where, how medical information can be stored, and who have the custodian or authority, or in terms of security of the medical record. Okay, say for example, especially in human resource department, they have all medical records of the employees, right? So they need to have a proper policy in terms of managing this credential information of their employees. What happens when the employee resigns or retires in terms of mechanism of access and consent for disclosure of this information? So it needs to have a written policy. You see, in terms of occupational disease, some of the disease are acute in nature, some of it are quite latent in nature. Say, for example, if you have been exposed to asbestos, right, during your working years, and then it will take probably after you are retired before you probably end up getting lung cancer or so on and so forth, right? So, in order for them to be eligible, in order for us to prove that the lung cancer is as a result of exposure to asbestos, then they need to have access to all these employees' work record, medical record, and so on and so forth. Okay, so that's where this problem came in, especially after the employees have resigned or retired. Workers have right to access medical records and correct inaccuracies. Of course, informed consent without duress for disclosure. That's quite important as well. If you want to share the medical information, then you need to have informed consent from the patient as well, and it should be done without any duress or under pressure for disclosure. Special status for information on drugs, alcohol, and HIV status. Because all these are quite important because of the stigma related to it. So need to be all this information be tracked very carefully. Okay. So let's look at International Code of Ethics for Occupational Health Professional, ICOD duties and obligation. Okay. Its aim and advisory role. So basically, under OSHA, right? The in the international setting, they have this international code of practice by the international bodies, so that their role is basically as to provide advisory role on how the health professional should conduct their behavior in relation to managing patients' information, so that they do not deviate from their medical ethics as well. So the aims and advisory role is to safeguard and promote health of the workers. So it provides clear guideline that most important thing is to safeguard and promote health of the workers. So basically, it's our first medical ethics, right? Beneficiaries, right? Promote a safe and healthy working environment, protect working capacity of workers and their access to employment. That's the thing, protect workers' capacity of workers and their access to employment. Because injury, disease, disability, all those can affect the workers' employment status, right? If you have disease, sometimes you end up being medical board as a result of your disease, and as a result of your disabilities. Provide competent and honest advice to employers on fulfilling their responsibility of safety and health elements. Workers on protection and promotion of their health in relation to work. So it's very important that we provide competent and honest advice to employer to make sure that the workers' safety and health is important despite whatever hazard that they are facing in the workplace. Okay, you cannot just simply say, okay, you need to deal with this particular hazard in order for you to be promoted. So that cannot be done. It shouldn't be done like that way. There should be some form of control measures. Maintain contact with OSH committees in the work. Occupational safety health committees in work. Basically, in Malaysia, under OSHA regulation, each workplace with more than 40 employees, they need to have a safety and health unit, right? As an OHD practitioner, you need to work together with the Occupational Safety and Health Committee. Okay? Or a primary loyalty to the workforce, the community they serve, and the environment that going to be affected. Practice should be performed according to the highest standard and ethical principles and maintaining respect for human dignity. Shall seek to ensure professional independence in execution of their function and shall be honest, objective, and reliable when called to give opinion. So when, say for example, if you are called to the court or you are asked to provide the risk assessment and management communication to the general public, you have to be honest, objective, and reliable in terms of delivering your advice on particular issues. Okay, maintain and develop professional competence. So it is your duty as well to ensure that you continue with your education, so that you become a competent professionals and do not undertake all responsibilities unless you are competent. Meaning, when after you had that particular training, then you can say that, okay, I'm certified OHD doctor, so I'm able to do this kind of medical surveillance and so on and so forth. Okay. Formally advise those not taking professional advice of adverse consequences. Avoid professional judgment being influenced by conflict of interest and inform employer or client of conflict of interest. Shall not disclose information that is prejudicial to business of present or past client. So same thing in terms of patient confidentiality. You also need to, if you've been hired by organization to become their in-house doctors or their doctors, so you need to protect your client business. Shall ensure information necessary to safeguard OSH is made available to those they are responsible to. Shall not unfairly discriminate on grounds of race, color, religion, or belief, sex, marital status, age, etc. That's basically you as a medical practitioner, you should know that you cannot discriminate people based on their race, color, religion, belief, sex, or anything. And you must act within the law. You shouldn't break the law. Additional guidance given to consultants, employers, researchers, providers of education and training. Disciplinary procedure for those violating. Okay. In conclusion, managers to ask themselves, are we doing enough to ensure the safety and health of the workers and the community around? If, say for example, you are the owner of a business, factories, or establishment, you need to ask yourself, are you doing enough to ensure the safety and health of your workers and the employees around the vicinity of your establishment, right? And then in terms of employee, they need to ask themselves, are we doing enough to cooperate with management to ensure our safety and health and of those around us? You need to ask yourself that as well. And for each practitioner to ask themselves, are we doing enough to ensure that the OSH needs of both these groups are met? So maintaining a fine balance. Okay. So in terms of COVID-19, same thing lah. if you're looking at the COVID-19 at the moment, in terms of management, that means those from the KKM, either they're doing enough to ensure the safety of the healthcare workers and also safety of the community, right? In terms of the frontliners, you need to ask yourself, are you following the protocol or not to ensure your own safety and health? And those working around you as well, because once there's a break in the PPE, you're exposed to the COVID-19, and then without realizing, it's possible that you are infecting other healthcare workers as a result of your incompetence. Okay, that ends the first lecture. Any question?
Assalamualaikum Doktor. Kamal nak tanya berkenaan macam most OSH regulation, contohnya di kilang lah, yang saya faham is self regulation and as practical as possible. So kalau kita as public health punya pengamal public health ni, apa step kita nak strengthen this thing, sebab sometimes most of the time dia orang macam lebih kurang je lah dia punya pelaksanaan dia.
Okay, under OSHA memang dia looking into the involvement of occupational safety and health in the workplace is based on the workers, the employer, and also the government. Okay, but the government meaning the enforcement agencies from DOSH. Okay, so bila dekat tempat kerja tu, you need to have employee representative, employer representative, and then they come into a meeting in the safety and health committees, right? So within the safety and health committee, the employee representative will mention to the management on what kind of safety issues they encounters and what can be done to overcome that. So all those need to be in motion. Okay, but as I mentioned, the ethical dilemma is there. And then the conflict of interest is there, right? Either you want, because sometimes some of the control measures are very expensive, right? When it's very expensive, that's when there's a term where as low as reasonably practicable. Bila ada alap lah, we call it as low as reasonably practicable, meaning they be able to reduce the hazard as low as reasonably practicable. So reasonably practicable meaning either in terms of cost, there's adequate money in terms of reducing the hazard. Okay, if there is any specific method that available to be able to reduce the hazard. Okay, so if none of that is available, that's where the last method came in, which is using the PPE. Okay. Okay, boleh? Mana yang tanya soalan tadi tu?
Okay, faham.
Boleh faham tak?
Boleh Doktor.
That's basically the concept lah. Basically nanti DOSH akan it is between the employee and the employee. They need to work together. Under OSHA too, the employee and the employee need to work together. But as I mentioned early on in the lectures, like because of a difference in power, kan? Kadang-kadang employee themselves, they are afraid to speak out. Nanti kalau dia banyak sangat cakap, nanti kena buang kerja, kan?
Enforcement pun tak larat nak cover semua.
Exactly. The enforcement are unable to do that. Tapi itulah, that's the whole point of OSHA is for the employee and employee to work together to ensure the safety and health of everybody in the workplace. And then DOSH semua akan datang dan bagi advice dan pemantauan sekali-sekala je lah. Or if there is any accident, or near miss incidents that happen in the work area that has been notified to them. Okay. Okay. Any other questions? Before we move on to the next one, Boleh?
Boleh doktor.
Okay, doktor.
Boleh doktor.
Okay. Semua yang tadi tak masuk lagi tadi tu dah masuk ke?
Saya belum boleh sikit.
Okay. Jadi mana yang apa? Kita akan break for 5 minutes. So I'm gonna share the attendance. Nampak attendance? Boleh kita break for 5 minutes?
Okay, doktor.
Apa menghilangkan apa medical ethics tu yang menyerabutkan tu. Okay. So we take break for 5 minutes. Okay. We come back at 2:50. Okay. So mana yang tak log in lagi tu boleh log in. Okay. Okay, semua dah masuk balik. I can stop sharing this, okay?
Excuse me, Prof. Tak dapat scan lah.
You tak dapat scan? Kenapa you dah pakai UKM tu?
I memang pakai UKM punya tu. Mungkin my internet lah memang selalu slow sikit. I have to scan 10-15 minutes baru dia dapat scan.
Sekejap. You ada nombor phone saya ke?
Apa dia?
You ada nombor phone saya?
Ada, Prof.
Chat box.
I can message here, Prof. The conversations.
No. Show conversation ni, I akan bagi you nombor phone saya.
Okay.
Then WhatsApp me your ID and password.
Okay, Prof.
Nanti I akan masukkan manual. Sorry. Kan ni bila batuk-batuk je, apa? Merisaukan. Okey, boleh nampak? Boleh nampak?
Boleh.
Boleh tak?
Okay, so what are the roles of occupational and environmental health professionals? Some of you might want to become OH professional and environmental EH professional. Yeah? So occupational health and the ILO, WHO Committee on Occupational Health is basically maintenance and promotion of workers' health and working capacity, all covered under occupational health, and improvement of working environment and work to become conducive to safety and health, and also development of work organization and working culture to ensure that it's a safe, healthy, and so that be able to enhance productivity. Okay. So environmental health, basically environment is the whole complex of physical, social, cultural, economical, and aesthetical factors which affects individual and community and ultimately determine their form, character, relationship, and survival. Whereas the environmental health deal with the health consequences of exposure hazard in their homes and communities to contaminated soil, water, and air. So in terms of environment, everything is mostly about soil, water, and air. If there is any contamination or hazard in there, okay. So, but from occupational health perspective, everything is focusing more on the workplace, okay. So there's a lot of people involved with occupational safety and health. So you can have occupational physician, you can have environmental physician, you can have occupational health nurse, you can have psychologists, because sometimes the employees can have mental health problems. So they need psychologists. You have industrial hygienists. Industrial hygienists are the people who actually do all the measurements and all the monitoring of the hazard in the workplace. You need epidemiologists, you need engineers. These engineers be able to design a much better machine or equipment, okay, in order to protect the employees from the hazard in the workplace. You can have toxicologists, which is important in making studies on the chemical hazard, the chemicals and its hazard to the human health. And then you can have microbiologists for the biological hazard. And you can have chemists, especially those working in the chemical factories, right? So the whole host of unit, the whole host of team, in order to ensure safety and health of the workers and the workplace. Okay. So what are the roles of occupational environment health professionals? Basically to identify and assess the risk from health hazard in the environment or in the workplace. Okay, so occupational, they're more focusing on the workplace, but environment health, more focusing on the environment. Basically to protect and promote public or workers' health. So in the occupation setting, more on workers' health, but the environment health more on the public and also workers' health as well. Whatever happens in the environment affects the public and the workers as well, right? So carry out surveillance of factors which may affect the health. So they do all this form of surveillance, okay, and improve the condition that might harm health through sound control measures. So once you identify the hazard and you determine that there is a risk posed by that particular hazard, then you need to come up with control measures in order to protect the employees from the hazard or the public from that hazard. Okay? Maintain health and achieve the highest possible standard of health in the interest of the community and strengthen health promotion. Health promotion is very important. So without health promotion, the information will not be able to dissipate inside into the community or within the workforce. And then develop safety and health culture and management. So come up with the culture, safety and health culture is quite important so that the workplace or the public themselves have a high level of safety cultures. Okay? Especially at the moment, right? When we are talking about everybody need to wear masks, everybody need to use hand sanitizers, everybody need to keep distance. So all those is a form of new culture, right? To ensure our safety and our health during the COVID-19 pandemic seasons. Okay. So role models, occupation and environment practitioner serve as a role models as well. They become the advisor either to individual, group of or to organization. Okay. And they become the agent of change in terms of to the workers or to the public or to ensure the environment is well protected and to the process that can pose hazards. They serve as an expert where they provide the evaluation and they do risk assessment in terms of hazard in the workplace or in the environment. They can also serve as a counselor. They can also serve as a trainer to train workers on the safety aspect. Okay? As a source of knowledge, and their role is to disseminate information related to safety and health, skill development resources. They are the one who provide the skill, teach the skill to the newer practitioners. Okay. They should have the expertise to identify the problem, treat or fix the problem, assess the effectiveness of the program and intervention. Okay. So macam you all kan ada buat high ride kan? Betul? Ada buat high ride kan?
Ada.
So high ride is basically a method of identifying the problems and then treat and provide suggestion to the problems, and then to see the effectiveness of the program or intervention that been implemented in relation to the hazard. Okay. they need to have competencies. They need to be competent. Okay, competent in identification and assessment of risk from health hazard. So they need to be able to do health risk assessment, be able to advise for control measures, control methods, diagnosis skill health related to environment or occupational hazards, assessment by, sometimes the assessment require multidisciplinary approach. In order to properly identify and assess risk from the health hazard. Okay. Jadi bila dekat di RPH nanti you akan belajar risk assessment and management. You akan belajar dengan lebih detail bahagian ini. Okay. In terms of medical surveillance program, you need to be competent to do medical surveillance program because certain hazards they have specific medical surveillance. Okay, that be done based on that particular hazard. Say for example, noise hazard, they have specific medical surveillance program. Lab, they have a specific medical surveillance program. So all these are very important for pre-employment and pre-placement examination, so that they be able to ensure that high-risk workers are not being exposed to that particular hazard, and then be able to do periodic medical monitoring and examination after illness or injury or termination of examination. So that meaning that they need to say that okay, you're okay now, so there's no need for you to do further investigation or examination. In terms of environmental surveillance, monitoring of hazard, organizing and undertaking inspection. Okay, that's very important for the environment surveillance. Advising on occupational or environmental health, assessing control system designed to eliminate or reduce exposure. Select appropriate PPE. Okay, select appropriate PPE. Same thing like at the moment kalau you kerja dekat KKM masa COVID-19 tu, probably some of you are part of the committee to select the proper PPE kan, and dealing with COVID-19. So this is an example of in order for either occupational or environment practitioner to properly do a risk assessment, they need to do a walkthrough survey. Macam you buat high rank lah. You buat high rank macam mana? Anyway, kalau grup yang lain sebelum ni dia orang pergi satu hospital berjalan tengok hazard. Kalau macam you all ni buat high rank macam mana? Buat high rank kat rumah ke?
Retrospektif, Prof. Retrospektif.
Retrospektif. Oh, you imagine tempat kerja lama, lepas tu you buatlah high rank.
Yes, Prof.
Okay. Because once you do a walkthrough survey, then you notice that certain things there's an hazard there and need to be rectified. If you do not do any walkthrough survey into the workplace or into the environment, you're not will be able to directly see the presence of the hazard there, presence of the danger there. Okay. Same thing in the workplace. You can see that in this example, the workers do not wear any PPE. Okay. Same thing here. If you're working in this kind of environment, it could be very stressful, right? Do you know what it is? What is this?
Balak air.
Yeah, this is underwater logging. Dulu kan masa dia buat empangan kenyai tu air naik kan, lepas tu kat bawah dekat tepi-tepi dan dasar tasik tu ada banyak pokok-pokok balak. Jadi they employ people to do underwater logging. Okay. Jadi you can see it here, they hardly wear any PPE lah in order for them to properly do the job. Okay. In terms of going back to the competencies, advising on the planning and organization of work or project, advice on the production of new working system or technique, including human factors in the process design. Okay. Participating in formulating safety, health, and environmental policy. So the policy need to be based on ethical principles. Public workers fully informed of the policy and their rights. Okay. Collaborate in providing information and training, so they'll be able to disseminate information and enhance skill development of the workers and participate in relevant committees, evaluation of work or environment-related diseases. Contributing to scientific knowledge regarding hazard health, recognizing and investigating health determinants, analyze routinely collected data, conducting scientific investigation. You discover that at the moment you are investigate bila you buat apa your research proposal or project research kan, basically you're investigating health determinants and you're deciding what kind of data you're going to be collected, and then you're going to analyze the data. Okay. So to become a public health practitioner, you also need to have this kind of competencies. Okay. Advising and supporting on the implementation of relevant legislation, application and implementation of relevant laws and regulation, health policy, advising workers or public of their legal obligation. So that's why in first year the RPH, we have Occupational Safety and Health legislation. Okay? Semua kena ambil the RPH student, so that you know that what are the relevant law related to occupational safety and health, because it simply affects everybody. And then participation in health promotion program in terms of need analysis, cost benefit analysis, ni you belajar kat management kan. Seeking participation from various relevant group, evaluating and auditing health promotion program. So health promotion, kalau dekat PKD dia ada promotion unit kan yang in charge of all this. Okay. Betul kat PKD? Ada yang dari PKD ke?
Betul.
Ya, Doktor.
Ada.
Management of health and safety in terms of developing the policy, organizing a committee, planning and implementation of health and safety policy, and evaluation of the program or the policy, and then continuous action for improvement in terms of policy, program, planning, implementation. Working as part of a multidisciplinary services, promoting multidisciplinary scientific work on exposure data gathering, planning the efficient use of multidisciplinary resources, coordinating health surveillance, environmental surveillance, and other risk assessment. Jadi you akan belajar lah macam mana cara nak buat. Knowledge area and skill. In terms of knowledge area and skill, ni apa yang you tengah buat dah sekarang ni. You need to have medical science knowledge in terms of diagnosis, treatment, risk assessment, or analysis. Okay? In terms of diagnosis and treatment for certain disease, you dah belajar dulu masa undergrad kan. Nanti later on dia akan belajar a bit more on how to do risk assessment and how to do analysis based on the data that's collected. Laboratory sciences in terms of monitoring, relevant legislation and policies. That's why you're going to learn later on about the legislation and the policy, health promotion, education, training, and communication skills. You probably are wondering kenapa banyak sangat assignment dan kena buat presentation kan? Nak tertanya tak? Because you are on to improve is to provide you with training and communication skill lah. Tu sebab bila you dekat tempat kerja, you don't really do research kan. You basically just kerja je kan. Tapi bila kat sini you kena buat research and then you kena buat assignment, and then after the assignment you need to know what the assignment is about kan. Lepas tu then you'll be able to present your assignment. So all those are training you in this element supaya it prepares you to become a public health specialist later on in the future. Dia memang akan continuously have to do all those. Okay. In terms of scientific research, epidemiology and biostatistics, sama lah scientific research. Because now everybody are talking about evidence-based medicines. Yeah? So you cannot simply ask for money to do something without any evidence base, right? Especially if you want to do program and so on and so forth. So sometimes you need to do research and statistics, right? Yeah. And you need to have an area, some knowledge area on genetics as well. Especially kalau you decide to do a screening program involving genetic screening and so on and so forth, so you need to have knowledge on that area as well. Okay. In terms of surveillance, in terms of doing surveillance, you need to know about the disease, how people are being exposed to the hazards, and what are the behavior of the population that makes them exposed to the hazard. And then also behavior of the hazard as well. You need to know. Okay. In terms of toxicology, you need to have knowledge on toxicology, which is the study of agents that produce adverse response in biological system with which they will interact. Toxicology ni nanti budak-budak yang buat environment health ada satu modul on toxicology. Toxicology ni dia akan ajar lah macam mana you buat pasal toxicology lah, ada dose response, ada loyal, and how do you end up come up with permissible exposure limit based on loyal and so forth. Okay, public health ethics, in terms of human right, confidentiality, equality, risk communication, exchange of information of health risk, risk communication. You see now, the risk communication is very important now, right? Hampir hari-hari kita punya DG provide this communication kan, in terms of COVID-19. Tapi bila benda tu hari-hari, orang pun malas nak dengar dah. Betul tak betul? Awak dengar tak? Saya tengok je dia punya dekat My Sejahtera tu je berapa banyak kes. Lepas tu tengok dekat mana kawasan saya berapa banyak positif kes. Selalu tak pernah kurang daripada 10 lah kat kawasan rumah saya ni. Dalam masa 14 hari lalu mesti 14, 15, 16. Management, you need to be able to plan effective evaluation of your program. You be able to come out with cost benefit analysis, and then to ensure that you have a good building. Okay, ni semua you belajar kan bawah management kan. In terms of challenges being faced in implementation of environmental and occupational health. Because satu bawa environmental kan, satu bawa DOS. Kadang dia orang ni berdua ni tak bercakap satu sama lain, dia different organisation altogether. Tapi the new incidents yang pollution dekat river, dekat Johor kan? That's where the environmental department and the occupational health department need to work together, and health department as well So all three of them need to work together to overcome the problems, right? Yeah. So programs largely through enforcement mechanism housed in different agencies, enforcement agencies can. Barriers to effective protection of environment and occupational public health. Complex problems require coordinated responses of multiple agencies and various professional disciplines. Okay. Need for focused national and international leadership. Currently, sebab apa, environmental side, they have people that have champion in there. The occupational side, they have champion in there. Then there is a need for national and international leadership at the moment. Our DG is holding that post quite well. Lack of disease and environmental exposure, tracking, training of relevant professional, develop strategic partnership and financial support. Biasanya in terms of financial support towards environment and health ni is quite lacking lah. So primary focus of the government. Kalau you dekat apa KKM pun, the environment and the occupational element sort of like the last thing that people will look into. Okay, so focus on health promotion, train professionals, developing national performance standards and best practice, and provide technical assistance. Okay, so we need that in order to improve our environment and occupational safety and health in the nation. Okay. In terms of emerging trends, because of rapid industrialization, now is emerging and re-emerging of infectious disease kan. Globalization, natural disaster, terrorist attack, epidemics, the COVID-19, under-reporting of diseases. When you under-report the diseases, that cause a problem in terms of monitoring, surveillance, and so on and so forth. In terms of preventive approach, coordination of multidisciplinary agencies ni yang akan create problems as well. If there is no coordination or cooperation between agencies. Okay. Any question? Macam saya cakap, the topic is quite basic kan. Sepatutnya dia keluar masa awal-awal ni, awal-awal punya lecture. Tadi Paul you ada WhatsApp saya. Betul Paul? Palani Valley.
Palani Valley.
Huh?
Yes, I dah accept. I try to scan again.
You try scan again. You WhatsApp you punya student ID tak ada password, I nak masuk macam mana? Kata laluan tu tulis apa?
I try to scan again. Sorry Paul.
Scan lagi. Siapa yang tak scan boleh scan tak? Okay, well everybody is scanning. Any questions so far? Tak ada kan? Okay, quite straightforward. And then
Okay Prof, dapat scan lah. Dapat scan.
Yeah, good for you. So you might be asking about what kind of question that might come out, kan? So the question can be, what are the competency needed by the occupational health and environmental health practitioner? Itu boleh jadi soalan. The other question can be, how does the four pillars of medical ethics be able to guide occupational health practitioner and environmental health practitioner to become a better practitioner. Contohnya lah soalan ni, tapi saya bukan tanya soalan tu. Okey. Halo? Semua ada lagi? Dah sudah Kita punya lecture dah habis. So, ya ilah ilallah bisingnya. So saya jumpa hari Selasa 9 hingga 10 kan?
Hari Rabu,
Hari Rabu, hari Rabu 9 ke 11. Okey, so semua dah log in kan? Semua dah
Dah, doktor. Dah.
Dah.
Sebab bila kalau dah dan saya boleh download dan masukkan ke dalam ini. Okay, lecture dah habis dah. You all can go. Kan nak tengok saya buat kerja ni.